You're going to be hearing from a tremendous panel here, and I encourage you to challenge them with your questions, because it will make you better journalists and better writers. So with that, I'm going to introduce, this woman is amazing. Dr. Lisa Sparks. We actually had a debate on who was going to introduce her, because her resume is like this, and her title needs a 3x5 card instead of the usual. She's very, very amazing, and that's why we have her here. She is a Foster Mary McGraw Endowed Professor in Behavioral Sciences at Chapman University in California, where she serves as Head Director of the Masters of Science Graduate Program in Health and Strategic Communication in the Department of Communication Studies. And I think you get extra credit for just realizing what all that means. So with that, I'm going to turn this over to Lisa Sparks.
Thank you for that very kind introduction. I'm humbled by your kindness. I want to welcome you all to this event today, and we hope that you're all going to get as much out of it as we hope you will. And we hope also that you'll be ambassadors in terms of spreading the word about all the things that you're going to learn about today and be involved in. And Irene Marie, ask questions, challenge our panelists, and let's get that discussion going. So the idea is for us to take a bit of an informal approach, but in an organized fashion. So earlier I had given a warning, make sure all of your phones and technologies are set to vibration, because we don't want to interrupt the flow here. I'll go ahead and get started with the panel. So our panel is It's Okay to Talk, Mental Health in Media, as you can see above here. And you just met Marie Dyack, who has been spearheading this organization for a few decades, at least. And we have just this array of panelists. So first what I'm going to do is give a brief overview, and then I'll introduce the panelists, and then we're going to have about approximately 15 minutes of sort of organized Q&A with the panelists. So, as you know, or may not know, campuses across the country have seen a steady rise in the number of students like you or friends of yours who've been experiencing very serious mental health challenges. Many schools struggle to find ways to discuss and report on mental health issues without alarming students, but involving them, and also without harming their school's reputation. And quote, those living with mental health challenges often report that stigma can impose more barriers, can be more painful than the condition itself. The bulk of hurtful reactions comes inadvertently as a consequence of blind spots in someone's perspective. And I want you to kind of keep that quote in mind as we move along through the panel. Saddleback College, in fact, is taking the lead, and we're very grateful for Saddleback College. And Chapman, I hope, will be following your footsteps pretty soon. But you all are taking the lead in initiating this dialogue, open dialogue between college students, media professionals, and school administrators in an effort to promote what we call best practices in the portrayal of mental illness in media. How many of you all have seen TV shows that are depicting mental illness issues or mental health issues? Almost everyone, at least more than half, right? If you start thinking about it and start kind of thinking about and paying a little more attention to the TV shows that you're watching, I know you're studying most of the time, but for those few moments you have a chance to watch some TV shows or even news media shows, start to perk up a little bit about the depictions of mental health. You might see bipolar disorder depicted, you might see schizophrenia, you might see addiction issues, and now as you're starting to think about it, you're like, oh yeah, I saw that on X show, on Y show, on Z show, or on movies. And we've seen a big increase in the depictions over the years, and I think some of that really is due, maybe a large part of that is due to the efforts of the Entertainment Industries Council and the affiliates. So the media have considerable power and influence on the public, as you all know, and you all are going to be sort of the next generation. And a lot of that's going to be translating into social media context as well. And also, people are getting a lot of their health information from the internet and social media sources as well as traditional television. The next generation of storytellers, journalists, and social media strategists can use these tools to help change the conversation around mental health. So this is a step in that direction. So without further ado, let me go ahead and introduce the panelists. First, we have Wayne Muncho. Did I pronounce your last name correctly? Wayne Muncho, LCSW, is the Director of Transition Age Youth, and he's going to explain a little bit more about what that means, or TAY services at STARS Behavioral Health Group, where he oversees 8 TAY programs throughout California. He has over 25 years of experience working in the mental health field and was one of the founders of The Village, an innovative recovery model program serving adults with mental illness. Wayne recently developed the TAY FSP Toolkit in collaboration with the California Institute of Mental Health. He was the founder and director of the Mental Health Association's TAY Academy from 2000 to 2009. So there's a lot to talk with us about those transitional age youth. Next, we did have a speaker, Jean Harris Caldwell, but in fact, at the last minute, she wasn't able to join us, and so her colleague so graciously is able to join us today, Dr. Tina Freeland, who's, I'm just going in order here, who's a licensed clinical psychologist. Dr. Freeland works at Saddleback College in the Student Health Center, so some of you may know her, where she coordinates the mental health services and the internship training and supervision program. She has been an LP for over 36 years with extensive experience working with patients who have severe mental illness, particularly those in inpatient settings. She founded the internship program here at the college in the health center, primarily in response to the growing number of students that are identified with mental health problems who are seeking treatment on campus. She's taught several graduate psychology programs and actively supervises between 6 and 8 interns each year, providing direct therapeutic services to Saddleback students. Dr. Freeland also co-authored the Campus Faculty Guide on managing distressed, disturbed, and disruptive students, and presents to both faculty and staff on how to manage mental health problems in the classroom and on campus. In addition to Saddleback, her work here at Saddleback, Dr. Freeland maintains an active private practice in Laguna Niguel, where she's been working since 1978. So welcome to the panel. I'm kind of bouncing between pamphlets here. Next in line, we have Angie Pineda. Did I pronounce your last name correctly? Pineda? Journalism alumna, Saddleback College. So again, some of you may be familiar with Angie. She began her writing career in 2009 at Biola University, where she became an ambassador and spoke model and was hired to blog about college life. Perfect timing. She was also part of Biola University's PR staff. She left Biola to pursue journalism and began working as the life editor of the Lariat newspaper, of which you all are very familiar with, the student newspaper for both Saddleback and Irvine Valley colleges. After her first semester on the Lariat News, she became the editor-in-chief, where content from her first big news story was aired on the Fox 11 News in Orange County's KFI radio station. So, welcome to the panel. Melissa McCoy, our fourth line up here, background in journalism. Melissa is a media consultant for TEAM-Up, so we've been familiar with each other for the last year or so, a project of the Nonprofit Entertainment Industries Council, and a former deputy managing editor of the LA Times, where she worked for 17 years. Not that we're counting. She's been an ethics fellow at the Poynter Institute and served as an editing and ethics instructor for the Maynard Institute. Melissa has a bachelor's degree in journalism from Ohio State University and a master's degree in mass communication from Cal State Northridge. Welcome to the panel.
Thank you.
And next we have Nathan Sutton, who has background in entertainment. Nathan is an artist with a very diversified resume as an actor, writer, director, author, producer, diversified. Nathan and his wife Alicia, who's sitting in the audience somewhere, there she is. So they co-founded Mohawk Street Production, a production company committed to producing challenging artwork that highlights real-world issues. Their first feature film, Autumn Wanderer, has won multiple awards, including Emerging Filmmaker at the Hollywood Film Festival. Autumn Wanderer calls attention to the pain and complexity caused by schizophrenia as a young man discovers he has inherited the mental disease. And last but not least, certainly, we have Nidra Weinrich, who has background in social media and also is affiliated with the Entertainment Industries Council as the project manager of EIC. So also I've known Nidra for the last year and a half to 2 years, because I'm affiliated with the EIC as well, and have been since 2008, which has been really a wonderful ride. So Nidra Klein-Weinrich is a longtime innovator using social marketing and social media to bring about health and social change. As a project manager at the EIC, the focus is working with the entertainment industry and news media to transform public attitudes and behaviors related to mental health and suicide prevention. She's a member of the National Action Alliance for Suicide Prevention's Public Awareness and Education Task Force. As president and founder of Weinrich Communications since 1995, she's worked with clients like the Centers for Disease Control and Prevention, the Substance Abuse and Mental Health Services Administration, otherwise known as SAMHSA, the NIH, or National Institute of Mental Health, and the Office of National Drug Control Policy. So I have just given you sort of a a mouthful of introductions because our panelists are so well distinguished, and we welcome all of you to the panel. So, it's time to get started. First of all, we're going to devote 15 minutes approximately to the first panelist. And so Wayne Muncho will be sort of answering some of the questions that I'm going to be posing. We're going to kind of take a dialogue approach to this, but in a somewhat organized fashion. So first of all, I have kind of a two-pointed question. I would ask, what would be your definition of mental health and mental health issues, illnesses, disorders? And then following that, how would you explain the fact that colleges and universities across the country have increasingly been seeing a steady rise, very steady rise, in the mental health challenges in student populations? And what do you think, what kind of stressors do you think are contributing to that increase?
Okay, thank you, Lisa. I'd like to thank Team Up and Generation Next and Saddleback for hosting this, and I think it's really important, so glad for you guys to come out as well. See, the first question was, what's the definition of mental health or mental illness? I would simply say a sense of well-being and a connectedness with others, and probably some sense of hope and a future vision, future plan. And that's a big question and a very small answer, but I think I'll stick with that for right now. But the sense of relationship with others, I think, is critically important as well. To the question about the rising numbers, the sense of much more prevalent amount of mental health issues, mental health concerns on colleges and universities. I have three ideas. A couple of it connects to some recent research, but first of all, I would say that there's a good thing happening, and that is there's a lot of youth accessing, attending colleges across the United States that in the past wouldn't have. So I think some of the research points to that there's many young people with pre-existing conditions, and I take pride in that because we've been working so hard to help them access colleges and attend schools such as we work close with in Long Beach. So I think that's a good trend and is part of what that sense of, wow, we're seeing a rising number of people with mental health concerns and emotional distress. So overall, that's a good thing, but it's kind of like the Nirvana song, Here We Are Now, and so colleges are trying to figure out how they're going to respond to that increasing presence. The other good reason I think people are reporting an increasing number is that there is a greater willingness to disclose, a greater willingness to ask for help. And I know there's some studies that will be discussed today that still point to the very real issues of stigma, and I think they're there clearly. We have ways to go, but I don't have any doubt in my mind that there's a much greater willingness to disclose and ask for help than I would say there was 10 years ago or 20 years ago. We have a ways to go, but I would say the hopeful sign that I see is I think there's a greater willingness, and I think a lot of the efforts by EIC and a lot of anti-stigma campaigns you can attribute that progress to. The third issue I just would say it isn't as positive in my mind. It might be a little bit controversial, but I think there's just more of a rush to medicalize emotional distress, to diseaseify it. And I know that's not a word, but should be. That in the eagerness to label and diagnose and treat, which oftentimes is a push to medicate, I think that's oftentimes too rushed before we really understand that emotional distress isn't a mental illness. Most everyone experiences it, how people cope with it, how they adjust to it. That a trauma-informed approach, for instance, one possible issue may have to do with trauma exposures, that the guiding principle of that is, what's happened to you rather than what's wrong with you. And I just think that's a far more engaging message for young people to encounter, not so much, do you have a biochemical imbalance that needs to be immediately medicated. I think, my opinion is that's pushed quite a bit by pharmaceuticals, and so there is a much increased percentage of young people using on psychotropic medications. But I do think I prefer just to think of emotional distress that a lot of young people and students experience, and that the key part of that is having some empathic listening and some people to let them know they're not alone in this issue.
Thank you, Wayne. Also, I was wondering how, you kind of touched on this, how do you think that schools could best address this increase that we're all seeing every campus across the United States, certainly? And not only in how schools could best address, but what are the majority of types of mental health issues or concerns that you are seeing?
Mm-hmm. Well, to contradict what I just said, I'm going to say a couple labels, but I'll stick with emotional distress as just, let's talk about that first. But we're certainly talking about mood, emotional disturbances, mood disturbances, and anxiety. And then there's, that other subset of first episode psychosis is the formal language of that, but what some people just call anomalous experiences. Don't know what's going on, but something that no one else can agree to is happening to me, but they might be reporting some disturbing experiences that other people are telling me that's not really happening. So between disturbances of thought and mood and perhaps hallucinations of various kinds of psychotic experiences is most commonly reported for this age group. And your other question was what to do?
Yeah, how can schools best address what they're seeing, what we're all seeing in terms of the increase? Not only dealing with the increasing numbers, I know at Chapman University we've been increasing our staff for our mental health services dramatically over the last decade. So not only increasing the number of staff, but how can we best address the needs that you're seeing?
Well, a couple thoughts I would have about that is part of would be to make sure that there's what I would call navigators on campus. Maybe perhaps Tina can speak more to this, but oftentimes there's a real disconnect between what a counselor on campus may be seeing and how familiar and how many relationships they have outside of campus when they need added resources, added consultation, and added help. Sometimes there's especially now as Affordable Care Act and comes into play, how that will change things and hopefully improve things. I think it will, just for the many youth with insurance, without insurance, on their parents' plans or not, and so forth. So part of that would be, will hopefully Affordable Care Act improve access for students or for a counselor on campus to understand what other help might be available. The other part I really like that a lot of campuses have started, of course, is there's peer supporters. I think other young people with shared experiences, life stories of overcoming some of this kind of emotional distress, I think is a very powerful message of just other young people being available to talk. And perhaps it's not avoiding, but sometimes it may not be that contact with that formal professional who may be there with a diagnosis and you have an illness. And I think a lot of young people need to experience that, like, how weird or strange or horrible am I, just to be able to talk to some other people who can normalize this experience of feeling stressed out.
Related to that, I just had a thought that it might be interesting for campuses to set up something where they give some training to university students who could participate in such a peer, a kind of formalized, or not too formal, but peer evaluation, peer talking kind of thing. And then maybe they could get an hour of credit in doing so, right? I mean, because students are always looking for credit. But anyway, I just throw that out there because there could be some ideas around that, a way of involving students but giving them some minimal training, so where there's still going to be that peer support. The last question I would have for you, and then we'll move on to the rest of the panel, is I'm curious about your experience with the TAY community and what that means exactly.
TAY is a term that's more common in public mental health sectors, and their mission is to turn all of life into an acronym and apply letters to all experiences. TAY, Transition Age Youth, describes youth between ages 15 to 25. This is a California term. I notice other states have different acronyms, different terms. But typically, these are youth coming from impoverished backgrounds, where many youth who are coming from foster care, from probation, from exposure to trauma of a mentally ill parent, or perhaps a parent that's been in prison. So it's those youth that I was mentioning earlier that with a lot of support they can make it to college campuses, but they've already experienced a tremendous amount of adversity and mental health treatment usually.
Such an important age. As many of you all may know, many students are affected, as we're hearing about, especially with this age group, the TAY age group, as a lot of these illnesses emerge with this age group, a lot of the spectrum disorders, and you all know more about that than me. I know a little bit about that with the research. But only a third of those who need it seek help. Stigma remains the #1 barrier to seeking help. And I think we've all sort of felt that when we've been dealing with mental health issues and hearing people talk about it. It's still in our society, this sort of stigma. People don't feel really comfortable talking about how they're feeling. And if it gets a little too weird, people kind of shut down. And so we're trying to open up the dialogue here. Most colleges offer mental health resources, but schools are reporting to us that 2/3 of students that experience mental health challenges actually aren't using these resources. And we would like to see this change. It is shifting, it is changing. We'd like to see it change even more to help you all, to help your age group. And how does stigma play into this? That's the big question, that's kind of an overarching question that I want to make sure we're all sort of addressing. So now I'll be transitioning to our second speaker, Dr. Friedland. And here we go. I want to transition to sort of our campus media, reporting on mental health on campuses and this sort of thing. There's a quotation from Newsweek, a Newsweek article that talks about schools' widespread fear and reluctance across the board to promote diversity that encompasses mental disabilities and mood disorders. And so another overarching question is, why are schools fearful of dealing with mental health issues when in fact this is where we're seeing a lot of these mental health issues play out? Maybe starting with the family and then extending to schools, because most of us, well, we've all gone to school, at least in the K-12 school system, and more students are going to college, community college, and four-year colleges as well. So Dr. Tina Freeland is here to address some of these issues, and let me start with the question about the campus newspapers, which the Lariat is here at this campus and as well as Irvine Valley College. How can campus newspapers report on mental health issues occurring on their campuses in a way that doesn't harm students nor sensationalizes the stories? Because there's a sort of fine line there in terms of getting, reporting responsibly on these delicate issues. Address balance between having an open dialogue, particularly when it comes to things like suicide or shooting, sort of taking away the personalization of the language that we often see in media in the ways that people are reporting about a person who has allegedly engaged in one of those acts, as well as concerns about the safety of other students and perhaps the school's reputation. So you may be seeing some of this in your office, and then certainly the administration would be involved in this kind of thing. But as representative of the university, I'm just curious what your thoughts would be, having a foot in the health center and a foot in administration.
Well, I think that the campus journalism has a very potent tool to be able to address the issues of stigma and prejudice as they surround mental health issues. We especially appreciate the Lariat and their efforts as they have reached out to the Student Health Center throughout the years in asking us to provide interviews and strong clinical information about different forms of mental health. That not everyone who is depressed is suicidal. Not everyone who is suicidal is visible to the student body. Not everyone who has a thought disorder like schizophrenia is acting out in class. So being able to provide really clear and unbiased and non-sensational information, that the journalistic tool is extraordinarily important in disseminating that. And the campus newspaper is a very important means of communication to the student body at large. The students read the newspaper and they read those interviews. When there is an event on campus that involves a tragedy, and we did have a death on this campus in the last academic year that involved a fire. Typically what happens is that before the administration has any opportunity to be able to filter the facts to the students, it's usually being disseminated by perhaps a local news station, because the surrounding community, law enforcement and otherwise is here. But also students are texting, so social media and texting happens much faster than does administrative communication. And the role then of the administration, I think, typically is to be able to get the facts to the students in a coherent way, that there is not exaggeration, because quickly stories filter. If it's a student in class who's been involved in any kind of a tragedy, that those stories will filter rather quickly throughout the campus. One of the things that's extremely helpful that the administration does when those kinds of events occur is they typically will ask representatives from the Student Health Center to go and be present in the classrooms, to go and talk to the students. We had a very unexpected death of one of our instructors this last semester. It affected many students. And we went to each of the classrooms and spoke. The Laureate then did a marvelous follow-up article on that instructor, and it provided, I think, a sense of being able to address the questions that we all have about a tragedy, whether it's student or faculty, and also put into the perspective of, was this a mental health issue? Was it a medical issue? Was it an accident? What really did occur? And then there's always the balance that we're trying to work with that has to do with the privacy of the individual that would have been involved in the accident.
Oh, absolutely. In fact, I'd like to also get Angie's perspective as a journalism alumna, from the perspective from the other side, about how, what are some of the issues that have posed a challenge for you and the newspaper and the Laureate and the reporting, and how do you think, in your experience, that campus media can contribute to reducing stigma that maybe you experienced, or to what extent did you experience that?
Well, it was actually quite difficult at first. The school wants to protect its reputation, and the problem with that is, as a journalist, it's our job to report and cover for our community. And sometimes, we have to kind of discern whether or not we should release certain information or not. In terms of stigma and whatnot, the Laureate has done a great job of reporting and covering suicide and depression since I left the paper. So I think it's important to, instead of waiting for something to happen, to report and create awareness and to prevent things from happening before they do.
And as we all know, language really matters. The subtle words that you choose to use as you're reporting on these illnesses and these events really matters in the ways that people are decoding the message. Okay, so you as the gatekeepers are encoding the message, right, and through the writing of your stories, the people you interview, the sound bites you choose to include or not, right? And maybe I'm stepping a little into Melissa's territory here, but I'm curious from the student newspaper perspective and the health center perspective of the following thought. If we think about some of the reporting that we've seen of, Joe committed suicide versus Joe took his life by suicide, and those subtle language differences, I'm just wondering what your experiences have been in reporting some of these very delicate issues. And also for you, Dr. Green, about when you're talking with your health workers about how to talk with students about these issues.
When it comes to suicide, we feel that it is most effective and most helpful to be very direct, to use language that might, in other circles, people are sometimes uncomfortable with the word suicide, or are uncomfortable that if you talk about it, it will plant an idea in someone's mind. So what we find is that by using the actual words, that in itself is powerful in bringing people forward who might be suffering from depression or suicidal thoughts, that we don't find that we have to protect the school or anyone really in particular.
Well, we're taught to, on the Lariat at least, we're taught to always be balanced and unbiased. So everything that we write always goes through the editor and the copywriter and even our counselors. So, every single word that's published, we distinguish it very carefully, and we decide as a team if that's going to create any issues or if it's actually going to help the community. We don't want to release information and sensationalize the paper just to, get a bigger audience, but more so to protect our community. So, just have a second, third, fourth opinion before publishing.
It sounds like you all work really closely together and well together, which kudos to you, because you don't see that everywhere, right? So at this point, I'll transition from campus media to news media or off-campus media, and how these issues are dealt with in the news in general, and how this affects how schools deal with them, a larger societal issue. And in doing so, I'll be asking Melissa a few questions here. First of all, how do you think that, in your experience, professional journalists respond to the presentation that you had a part of putting together?
Well, I've been, I'll just back up a little bit and talk about some of the work that I've been doing. I've been going around the state of California for the last year, giving presentations about mental health and the coverage of mental health and mental health problems and issues. And with a lot of ideas that I share with professional journalists and with students about how to do a fair and balanced job, an accurate job of covering mental health issues. And for the journalism students who are here, or very filmmaking students who are here, anybody who is affiliated with the media, the most important thing that I would tell you is what I tell professional journalists, which is to be fair and accurate. And it's always more important to get it right than to get it first. And that can be hard for journalism students sometimes because you're being pushed to get it first. But you have to be right. Being right is important. So when Dr. Freeland, spoke about, the potent tool that's there, that's true no matter what level you're practicing your craft at. If you're in a junior college or you're working for the New York Times, you have to be practicing it in a fair and balanced way. So I wanted to make one comment, Lisa, about the idea that, the journalism students have their job to do, and, the university or the college might feel that it has a reputation to protect, and I completely understand that. Those don't have to be mutually exclusive things. Listening to the doctor talk about, going into classrooms after something's happened, giving some support to students, to me, that is protecting the college's reputation. So things are going to happen that we can't control, and the administration can't control. The journalist's job is to go out and report on it, to get it fairly, get it accurately, and be balanced in the approach. You can get the work done that you need to get done, and it's up to the college to protect its own reputation through what steps it takes if there is a tragedy. So what do you do after something's happened? That's how you protect your reputation.
We've had some discussions about myths versus truth in news media, and what do news media usually report when it comes to mental health. I'm wondering if you could weave in some examples for the audience.
Sure. What the media do really well, again, it doesn't matter so much the level that the media that it's being practiced. Media are really good at being reactive in nature. That's sort of what we do. We get trained from an early age, if we go to journalism school, that you react to the news, because you have to. That's what you do, you cover stories. When it comes to mental health issues, that has resulted in our covering mental health as an issue of violence. And already today, just from the things that we've been discussing, we see that it's a very reactionary method of dealing with it. And what I do when I talk with professional journalists and with student journalists is to try to get people to think more about all the different kinds of stories that are out there. Yes, sometimes there will be violence, and sometimes people with mental health issues will be involved. When they are, you report it fairly and accurately. But we know for a fact, and maybe this is something that you're going to address in one of the witnesses, but we know that people with mental health issues are responsible for only about 5% of violent acts in the United States. You don't know that from being a media consumer. You would never know that, because that's what isn't a sort of steady diet, because it's breaking news and it gets covered. So I just try to encourage people to get out of that box and think more about, Marie spoke about it in her introductory remarks. We know that probably 1 in 4 people at any given time in the United States is dealing with a mental health issue. So what I tell people when I go out and speak about this is that statistic tells me that most of us in this room, most of us in this country, either have dealt with our own mental health issue or we know somebody who has. It could be a parent, a neighbor, a brother, a cousin, someone we're close to. It could be a colleague, it could be a fellow classmate. That tells me as a media person that readers, listeners, and viewers care about this issue. They want to read more about it, and they want it to be delivered to them in a way that isn't just focusing on violence.
I had a question about the role that campus and media, campus and outside of campus journalists play in removing the stigma associated with mental health. I think you pretty much addressed that.
Yeah.
So I think I'll kind of move on to my next sort of thought, which would be when conducting interviews or writing articles that journalists are doing that have to do with mental health issues and mental concerns, what do you suggest they keep in mind? I'm thinking some of the style guide.
Sure. I actually brought some of the style guides with me. I think a number of you here from Saddleback should already have these, because I know that Amara Aguilar, and I'd like to thank Amara for having the seed of the idea to put this together, because I think this is a terrific opportunity to get people talking about this important issue. When I go into newsrooms, whether it's in a university setting or in a professional newsroom, I take this style guide with me. Some of you, I hope, have this. I have extras here, and I hope after the presentation, if you don't have one, that you'll come and get one. This is what we use, and as I tell students, when you get into professional newsrooms at some point in your career, I hope you'll see these there, because we're talking to professional journalists about it a lot. I'll probably end up talking to about 1,000 people around the state before the middle of the summer. What I talk about, this is a really terrific style guide. It was put together by former journalists with input from mental health experts. So this is a very practical, hands-on guide. just a couple of quick things that I'll address is, this deals with a lot of the language issues that Dr. Sparks was talking about, that Lisa said, we need to think about the ways in which we use the language, that's important. But there are also three key questions that we advise journalists to think about when you're dealing with a story about a mental health issue. Now, for the reporters in the room, you will know that you don't always know if it's going to be a story about a mental health issue. You may not know till you get there. If it's something very obvious, yes, you might, but otherwise you might not know. So the first question you want to ask yourself when you're reporting on it is whether mental illness is even relevant to the story. So that's a very important point. The first question you ask, should I even mention it? Okay, if you determine you mention it, then you want to go on and think about who the source is for it. And then once you've done that and you've established that the source is accurate, then what kind of language are you going to use? So please, if you don't have one of the style guides after the presentation come up, I'll give you one, and we can certainly get additional ones to you.
And you sort of touched on how you serve as a consultant for the Team Up project. Since you began working with Team Up, what changes have you witnessed in the reporting on mental health? Give us some examples.
Yeah, I'd like to think it's all because of Team Up. Of course we would, right? But I can't. I've got no empirical evidence to that. But I will tell you that I think this issue in particular, and Wayne kind of spoke about this a little bit at the beginning of his remarks, which is that I think this is an issue that more people in general are talking about, and because of that, it's getting more media coverage. And I think I'm seeing more stories that go in depth on issues. And the issue of suicide, of course, is a very difficult one to report on. I agree with the doctor when she said, she thinks it should be talked about and we should find ways to discuss it. But we need to do it carefully, we need to do it fairly, and we need not to sensationalize it. But I'm seeing more of that. So it's not just being swept under the rug, because, when more than 30,000 people a year in the United States are killing themselves, that's a serious health issue that we need to deal with.
Yeah, I think we are. We are.
Yeah.
We do have some data to come.
Right.
So let's transition now to entertainment side of things. Entertainment is very popular among all of us, especially college students. And there's various forms that we consume entertainment media. We love to watch movies, television series, and I know you're studying most of the time, but occasionally you're squeezing in that entertainment time. So the stories that we watch and we're exposed to also have a huge impact on how we think, how we behave, and in some ways sort of tell us what to think about and how to think about things. So the power and influence of entertainment to change the conversation around mental health is huge, and that's another reason why we're here. We have recognized the power of that, and particularly the decade-long work of the Entertainment Industries Council has recognized that. And so in many ways, that's why the Team Up project is going to college campuses and trying to really tap into the student population and to sort of raise awareness and involve you all. You all are the next generation. And so the more you understand these issues and how they're increasing in our society, you're going to be better equipped and to help not only your fellow students and friends, but also within your own families. So I'll transition to Nathan. I have a few questions to pose. I'm wondering what your experience is in writing, directing, acting, particularly in your feature film, Autumn Wanderer, which, as we know from the introduction, won Emerging Filmmaker Award at the Hollywood Film Festival. Congratulations. So I'm wondering, it portrays a young man whose father is living with schizophrenia and his own struggle with early symptoms of the illness. And I'm wondering what motivated you to make this film?
I guess the real answer to that question is just frustration of not getting to work as much as that we wanted to work. And we were frustrated with the types of material that is available for most actors out there. It's not satisfying from a dramatic point of view, and so with the abundance of crap that's out there, I started writing, and that led to the acting. And from an acting standpoint, which I think I'm an actor first before anything else, I gravitate towards things that are satisfying, that are real world issues, things that you might not have firsthand experience with, but that is issues that people deal with on a day-to-day basis. So the movie kind of grew. It was never intended to be a movie about schizophrenia and I have to get this message out, but it just grew based on the interests that, where my interests lie, I guess.
And then you kind of went along that journey. You're trying to figure it out, which, you know, we all are trying to figure it out. How were you trying to, you know, how are you trying to get the audience to perceive your characters, particularly the ones that were dealing with or living with schizophrenia?
Yeah, I mean, the way that I work, the things that I'm interested in, it's always been natural. It has to be truthful. So all the performances from our actors were 100% realistic things. There was no, my wife and I call it schmacting, where it's just kind of BS. You know, there's no real emotion going on here. And so we had to approach everything from that standpoint, from the cinematography to the performances, to the writing, everything. We approached it with, there's no BS here. This has to be legitimate. So all of the research, everything that came down was very much about having it be a story about someone that you could know. And that's kind of where we took it. The movie, it's never really identified as schizophrenia. We don't really go into it from a doctor point of view and someone seeking help. It's more, it's really about a guy who knows that he could have this possibility happening to him. He discovers that it's happening to him and how he's dealing with it. And so our approach was, this could be anyone sitting next to you. It could be your neighbor, it could be you. And I've had people come up to us at screenings that say, I really identified with this character, and that's kind of awesome and frightening too, because they're not coming out and talking about it. Through this discussion today, the thing that stands out to me more than anything else is definitely the stigma, but it's not so much the stigma as how deep the stigma goes. I think people have an understanding that mental health is just bad. If you have mental issues, it just equals bad. And I don't believe that that's the case. I mean, I was going through panic attacks when I decided to write this movie, and I included it into the script. And when I was able to acknowledge that and explore that, things started to get easier. So I think that's the real issue that we're facing, is that people are really shying away from things. Politically, we try to tiptoe around things instead of really just confronting what's going on with people and understanding that it is treatable. It's not just black and white. You have mental illness, you're screwed. I think there's a massive gray area that we're touching on. But it's really not, at least I take this opinion, that it's not different than a broken arm. You break your arm, you get treatment, and you're going to be better. And if we can establish that not at the college level, but at the home level, I think that's really where things can start to change.
You know, I'm curious about how we're talking about stigma and stereotypes throughout this session. And I'm curious how you touched on it a little bit, but I'm curious how you handled not sort of defaulting to the stereotype and kind of getting around that to have a more authentic figure.
Google's a powerful tool, and I used it regularly, daily, multiple times for the research. But there's so many stories, there's so many comment boards where people are just scared and they just want to talk. And I think that's one of the best things about the internet, is that people can remain anonymous and still associate with people who are going through what they're going through. So we were able to read a lot about that and understand on a kind of a second-hand level, I guess, of what people are dealing with. But truthfully, the thing that was most helpful was this documentary that was done by HBO in the late 80s. It was in 1989, called, I have it written down here. It was a program called America Undercover, and they did it called a segment called Into the Madness, and it was a brilliant documentary in the late 80s about people who were living with schizophrenia. And it was graphic and interesting to see what the people who have schizophrenia are going through, but more importantly, what their family members are going through and how they're dealing with it. So that was a real core part of our research, especially for the character who plays my father, Richard, who he was able to sit and watch that and kind of see the differences between schizophrenics who are medicated and schizophrenics who are not medicated. And that was a really great tool for us, and it was done a lot of years ago.
Now, my last question for you at this point would be, maybe you kind of came into this through the back door because you didn't even know you were going to do a film so much about a person living with schizophrenia. But in doing so, and now you're kind of, I hope you're kind of seeing through this panel how much that mass media, a platform of a feature film and so forth, can really transform public opinion. And I'm just wondering what your thoughts are on that.
It's, you know, the old saying, I wish I knew now what I wish I would have known then what I know now. I would have attacked everything differently. But that said, there's so many resources out right now for young filmmakers. Since doing this movie, we've been approached by a company called Cinecause, which is a company that is based, or is built to help advocate for cause-based filmmakers. Whatever your cause is, they want to rally around you and help raise funds, help raise awareness. The biggest problem with independent film is just trying to get people to see it. It's really hard to get people to watch movies that aren't, you know, at the multiplexes. So there are these communities through the internet that are great resources for filmmakers, and so I've seen the change since we made this movie. We made this movie 2 years ago, and there are so many other outlets. There's outlets like Seed and Spark. Vimeo just released, I think 2 days ago, that they're going to start doing a crowdsourcing platform. So it's not just about the crowdsourcing. You can dial in your crowdsourcing to whatever your cause happens to be. So going through the process of the movie, I've learned that whatever the next project that we're going to attack is, we can find our audience before we ever start writing. And if you can tailor your message to the audience, you can learn more, you can spread the word faster. That's probably the most that I learned from going through this process.
Amazing. Technology is our friend most of the time, although it contributes to our stress in ways that we can talk about later. But you just gave the perfect transition, actually, to our next panelist, Nita Weinrich, I'm going to ask her a few questions about ways that we can use social media to dispel myths and reduce stigma and discrimination. So my first question is, why, in your opinion and your experience in working with social media, particularly with the project, the EIC project, as a program director, why is social media such a good way and a different way, sort of a new way, to reach people around mental health issues?
Well, I think especially when we're talking about a college population, social media is ubiquitous. Let me just ask you all, how many of you are on Facebook? Okay, how about Twitter? Okay, Instagram? Okay, so I'll stop there, but you can see lots of people are using it here and using it to communicate about what's going on in their lives, and also to get information and to get news and to find out what's going on with their friends and what's going on out in the world. So when 1 in 4 people out there is dealing with a mental illness of some sort, social media is really a great way to get that information out there for people to share with their friends about what's going on with them, and to seek support from their friends, and also to find helpful information. So for those of us who are in the field of health communication, that's what we're really thinking about. How do we get that information out there to the people who need it? And social media can be really instrumental in spreading social change for several different reasons. It's great for spreading ideas from person to person. Things can spread really quickly. It can bring people together around a common goal, so building a movement around mental health. And in California, we have a relatively new mental health movement called Each Mind Matters that EIC is part of. And you can be part of it too, eachmindmatters.org. Social media also, and this has come up already in terms of how it influences social norms and how people think about what's normal in terms of what we talk about, how we react to things that are going on with us. If we see that our friends are talking about mental health issues and someone's really stressed out and are talking about it and say, okay, I just went and talked to a counselor about it, I feel much better. Everything's under control now. You know, seeing what your friends are doing helps you think about what you might do as well. And social media is a great way to spread that. But keep in mind that social media is not about the technology. I think for a lot of people, when you think social media, you think about you have to use a computer or a mobile phone, and that's what people are thinking about. But really, social media is about people talking to people. It all boils down to that. It's on a large scale. It's kind of word of mouth on steroids to some extent, but it can also be very intimate. It can be one person to one person talking. And information can spread quickly. People can react to that information immediately. So it really is spreading the word about things on a grand scale. The other reason why social media is so effective, I think, in terms of getting out information about mental health is because in social media, in general, the message gets spread from friend to friend or friend to family member. It's not just an organization putting out their information, and it's not just an advertisement. If it comes, information that comes from someone who you know, you're much more likely to trust that information. And to not feel like there's some kind of ulterior motive, you're not being marketed to. If your friend is sharing information with you that you think they think is going to be helpful to you. And finally, research has found that social contact with people who are living with mental illnesses is really the best way to reduce stigma. Just talking with someone who has a mental illness and realizing that that person is just a regular person like you. There's nothing scary about them, nothing weird about them. They're just someone who's dealing with issues, and you probably have your own issues that you're dealing with. And so that social contact element where if someone that you're following on Twitter, for example, is talking about what is going on with them in terms of living with their mental illness, that's a way for you to really learn about what it means, what their life is like, and to see that it's really not something that you should be scared of. It's just something that some people are dealing with, just like the things that you're dealing with in your life. So I think that's another reason why social media is so effective in terms of reaching people on this issue.
At Chapman University, we teach people through our Twitter feed, which is ChapmanHComm, tweeting relevant health and strategic communication. We teach them basically ways to tweet relevant health information. So I'm wondering, and a lot of other things, but that's essentially what we're trying to do. I'm wondering what your strategies and advice would be for students and others on college campuses and how they can use social media to reduce stigma and discrimination for people experiencing mental health issues.
Sure. Well, first, you just reminded me I should let you know what our Twitter handle is. It's Media Team Up. So if you want to follow us, we'd love to have you. But in terms of strategies, it's going to be a little bit different if you're talking about an individual or student who wants to just make a difference on their own versus an organization that's doing social media. So I'll start by talking about what you can do personally if you're using social media and you want to talk about mental health and help get the word out. So first of all, remember I was just talking about social contact. So if you're dealing with some kind of mental health challenge, if you're comfortable with it, share that. It's helpful for your friends and other people to see that, someone that they know and like and trust is dealing with it and to see how you're dealing with it. Don't be afraid to share your story, or if you have friends who have their own stories, encourage them to do so. Just don't share more than you're comfortable with. Keep in mind that privacy online is important, so you need to just do it in a careful way, in a way that is not going to make you uncomfortable later on. And also keep in mind that as you are, or someone is talking online about what you're going through, it's likely that some of your other friends will say, hey, I was just going through that myself last year. Or, wow, I didn't know you were dealing with that, how can I help you? So that's one thing. Another thing is, if you see a friend who is posting about having problems, or who might be posting suicidal content, maybe they're writing things about thinking about hurting themselves, you can take action. That's something that I would definitely recommend. I think pretty much all of the major social networks have ways to get in touch with the safety team at that network to let them know that someone is posting these kinds of suicidal thoughts so that they can reach out and get help to them quickly if it's necessary. Another thing that's really helpful is just sharing positive stories of people who have been living with mental illnesses, have gotten treatment and are living successful lives. There's all kinds of videos out there and news stories, and when you come across them, share them. They're really, really useful in changing how people think about mental illness. You can share resources on social media, things like okaytotalk.org, or the Suicide Prevention Lifeline, which is 1-800-273-TALK, T-A-L-K. So things like that, you never know when it might be just the right time for someone you know to get that kind of information. But make sure you use reliable sources if you're sharing information. There's so much inaccurate information out there. We don't need to be contributing more inaccurate stuff, so be careful about what you put out there. And then the other thing I would say as an individual and as an organization also, just to be thoughtful about the language that you use online. We've already talked about that a bit, but you know, words like crazy or nuts or psycho, even if you don't mean it in a hurtful way, can be perceived that way by someone who might be going through a mental health challenge themselves. And it does perpetuate those stereotypes and stigma. So the language we use does matter. So just be thoughtful in terms of what you're saying when you're online. And then in terms of an organizational level, for example, if the college wanted to do a campaign of some sort, I would say just to be very strategic about it, really thinking through what are those goals and objectives, what are the things that you want to accomplish, who the audience is, whether it's students who are experiencing mental health challenges or students who are not, but who can be supportive of their friends. There's a lot of different kinds of audiences out there. Thinking about also what kind of time and effort do you have to put in there, because you don't want to start a Twitter feed and then abandon it after a couple of weeks because it just takes too much time. So you need to be thoughtful about which tools you decide to use. And based on all of that, then choose which social network you're on and how you're using it, because you want to make sure, depending on who your audience is, that you're reaching them in the place where they are. And a couple more things, some other ideas at the organizational level. One thing is to find the people who are already talking about this issue on your campus. I suspect that there are probably some people who are very vocal about mental health issues and health promotion, and who are reaching possibly a lot of students and peers through what they're doing. So if you can find those people and work with them to get your messages out and get that accurate information out, that can be really powerful. Also, one thing that I see a lot from organizations, one mistake is that they tend to use Twitter, for example, as a press release. So it's like a press release, 140 characters at a time. People don't want to talk to a press release. They don't want to talk to a bureaucracy. So being conversational, having it be like a real person is speaking is really important. And this last thing I'll mention is that if you are, and Melissa has actually talked about this a bit, but if you're going to be talking about suicide in your social media, just be cognizant of the research that has found that the way that you talk about suicide can either have positive effects or potentially negative effects in terms of the risk of suicide contagion. There's a great resource out there called reportingonsuicide.org. It's a website that has guidelines for reporters on what things to keep in mind to make sure that when you're reporting on suicide and talking about suicide, you do it in a way that is not going to be harmful.
I think Melissa had something to add there.
Yeah, I just wanted to add one thing, especially for the journalism students who are here. Since your only agenda is to be accurate, right? It is a good idea to get connected in with some of these Twitter feeds that Nidra was talking about, so that you can find out, you can follow stories that way. You can find sources for stories by getting connected with some of these resources, even if you're not participating or answering back. But you can follow. They're like little mini story threads that you can follow and find sources for stories.
Now, I have one last question for you, Nidra, and because we want to get to you all. I want to hear from you. We're going to set aside a chunk of time for you all to ask the panelists questions, and then just to signpost properly, we will also have closing remarks from the panelists. So don't feel like you've said everything you need to say. We'll give you another chance to speak up. So, Nidra, last question for you is Team Up is about to release a set of guidelines on using social media for mental health promotion and suicide prevention, as you well know. What is included in these guidelines and why are they needed?
Yeah, I'm very excited about this. We've been working on this for a while. We've put together a set of guidelines that's specifically for individuals or organizations who are interested in using social media for mental health promotion and suicide prevention. And this is something that I've heard a lot from people in the field, that they have been refraining from using social media because they're not sure how to do it effectively and safely. There's a lot of issues that are really unique to the fields of mental health and suicide because of issues of stigma and the safety issues around suicide. So I'm excited about this. It's really close to being coming out. We're in talks right now with some of the major social networks around getting their endorsement on it. So we're just holding off on putting it out until we get that, but it should be in the next few weeks. And some of the things that are in there are ideas for the kinds of content that you can be putting out there, issues related to language use and using images. Some of that is from the style guide that Melissa was talking about, privacy and safety issues around it, how to engage community members. There's ideas for like hashtags that are commonly used, and Twitter chats that are going on the topics. And also the big one that we kept hearing the field needed is really how do you respond to potentially suicidal content that people are posting. So that's just a little taste of what's going to be coming.
All right, more to come. So at this point, we heard a little bit from each of our panelists and had a little Q&A, but we want to have Q&A with our audience. And those of you who are able to stay, I know some of you have classes that you have to get to next. So I'll just throw the floor open, and I'll bring the microphone over, and just make sure we're holding that microphone pretty close to your mouth so that we can hear what you have to say. So who would like to ask the first question? Just say your name and question.
Hi, my name is Danny Pescalisi, and I was wondering, do you feel that the Diagnostic Statistics Manual, 4th edition, is effective in how it addresses mental health issues currently, or is it overzealous or not fulfill the needs of the student populace?
So you're talking about DSM-4, which is the one that's just about to expire. And you want to know whether it's relevant to the student population, to their understanding of their own symptoms?
Of their own symptoms, and if it addresses how Wayne earlier said, he feels that some people find the need to over-medicate at times, or to push medicine to where that addresses the issues of medication, or if it does not fulfill the needs of the population.
For those of us that are in psychology and are really treating individuals, I think it's been a very helpful manual in that it helps us to cluster together symptoms and to understand how a diagnosis comes together. We don't use it ourselves for medications because we don't prescribe. Is it thought to be driven partially by pharmaceutical industry? Yes. Yes, has been thought to. I think there's a lot of controversy around the new DSM, which is out now. But it's a very helpful tool for people who are learning to become therapists. It's very helpful when you meet a person in a consultation office and they're talking about many, 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 many issues. It helps a new therapist especially to know what to look for, what a decision tree looks like for making a diagnosis, and that might be helpful for what the direction of the treatment is. That's only part of it, though. That has, in great part, it doesn't have to do necessarily with the whole person, the person's context, in their culture, and in their family, and all of the other variables.
Wayne, did you have something to add to that question as well?
I would add that, in my opinion, the DSM-5 isn't a helpful tool to a lot of students and can be damaging, partly for the comments I made earlier, but my reservations come in with that we name symptoms without acknowledging, causes and etiologies. I mean, there's reasons people are anxious, there's reasons people are depressed, and sometimes that isn't acknowledged clearly enough, just a labeling catalog. I'm not saying that that's what Tina does, of course, but it's what happens for an awful lot of people who seek help from a general practitioner. I mean, they're just where most psychotropic medications are coming from. So I think there's a real double-edged sword with the DSM-5 that I question sometimes. I do understand the values that Tina and most mental health professionals would say it's still useful, but I think there is a dark side of the DSM.
I think the other part of it is that you see the DSM translated into different kinds of surveys online, where you can go online and actually diagnose yourself. And when you begin to take symptoms out of the context of a person's life history and present history, and again, culture, very important variable for us not to forget, then what you really have is just a very sterile diagnostic tool that only has to do with a checklist and really doesn't have to do with the whole person and what their story is, their narrative, which is very important.
Excellent question. Another question. Yes.
I'm actually a comment. Hello, my name is Katie Lenhoff, and I'm an employee at a nonprofit here in Orange County, working with individuals and families affected by mental illness. I'm also continuing my education here as a student at Saddleback, and very proud to do so. I would just like to thank the panelists and Saddleback for hosting this event, for giving your time and your insights on these diverse and important topics, and also the participants here in the room whose questions and comments I'm looking forward to, for taking the time out of your studies. About a year ago, the nonprofit for which I'm employed was contacted by a representative from a Hollywood television station wanting to take a proactive approach towards mental illness, depicting family couples living, where one couple is living with mental illness, and hopefully portray that in a positive light. When our organization received this information, we were of course very pleased to see this kind of proactive interest in showing a broader picture of mental illness. Unfortunately, after several of our families got in touch with this representative, and none was ultimately selected to participate, we reached out to inquire with this representative, what was wrong with our candidates? Were they maybe too quiet? Maybe didn't come across well on the camera? Unfortunately, sadly, the feedback we got was, unfortunately, they're just too normal. These individuals living with mental illness were by no means living with slight cases of these conditions. These are individuals who, in their life experiences, had undergone experiences as diverse as suicide attempts, electric shock therapy, extended stays in the prison system owing to incidents with mental illness. And thanks to their access to appropriate treatment, their dedication towards their recovery, they were able to make these positive strides. And I just want to thank each of you and the future journalists and professionals in this room today for helping to shape that future of our media. Because unfortunately, when the very narrow picture of mental illness is portrayed, I think the panelists know, but maybe not everyone here in the audience has experienced, it does hinder that readiness to acknowledge and seek appropriate treatment, to have that vision and achieve that vision of a successful, productive, and satisfying future. So for those of you who are going to change that, I thank you.
So thank you for your question and story. This is a very important issue, and perhaps we should start with Nathan's ideas.
I would like to come in. I think that a lot of the issues with the type of companies that are reaching out to you for those kind of stories, they have to sell a product, unfortunately, and what sells is the extremes. So that's what you're going to see on the mass market. There are shows out there. One of our guilty pleasures is Parenthood, and they depict a child with autism. But even then, it's still, when the storyline's about him, it's about the acting out. So they do have a responsibility to advertisers to do ridiculous things to make money. It's not right, but it is what's going to sell. So I think that looking for that to happen on a mass media platform is not realistic yet, unfortunately. But I do feel like writers, musicians, and independent filmmakers have a responsibility to tackle those things in a realistic way, because they have the platforms to do it without running through 100 people to approve your project. There's literally myself and my wife, if I want to ask her about our movie.
There's a story there.
But at the end of the day, if you are going to be an independent filmmaker or a novelist or a journalist who's writing for a blog, you don't have to ask for permission. And you can be blunt, and you can be forward, and you can be honest without really needing approval of anybody else. So I think that it's going to happen more on a grassroots level than straight from NBC.
And both Dr. Freeland and Melissa have something to add to that. We'll start with Dr. Freeland.
One of the things I wanted to point out is that many people in the broad public, their introduction to a mental health issue is through the media, especially film. If you think back several years to the movie Rain Man, that was probably one of our first broad public awarenesses of autism. If you think of the movie Ordinary People, it was one of our first introductions to the concept of survivor's guilt. And filmmaking, while it has a way of being able to be very poignant about features of mental disorder, and in that way is extraordinarily powerful in educating as to what a very specific picture of a mental illness can look like, and is used very often in classrooms, community college, graduate school programs. The film is often used to educate people, whether it's a student who's going to become a psychologist or a student who's sitting in an introductory class and for the first time is getting a picture of a mental disorder. But film is very powerful for us.
I was going to say that I think it's happening more and more that these depictions are being, put into television as sort of running storylines and that sort of thing. And in fact, EIC recognizes this type of work every year with annual awards called the Prism Awards, which are coming up in April. So I'm thinking like Homeland and Silver Linings Playbook, and so we're seeing it more. I think Nathan makes a good point that for many outlets, it's all about, can this make money? But as we're seeing more ways to get